It's the state's answer to getting more COVID-19 vaccines into the arms of more minorities. But we found the state's process created to make the distribution of this vaccine more equal is actually riddled with inequities. They are Floridians disproportionately impacted by the coronavirus and reluctant to get the vaccine.
They've come up with the vaccine, I think, very quick.
So in January, state leaders announced they would be partnering up with Florida churches and Black communities, providing them hundreds of COVID-19 vaccines. Call it the state's shot at closing the gap of vaccine inequality.
Thank you.
But much like the state's overall vaccine distribution plan, we discovered its minority church program is not based on data, but instead a wing, a prayer, and a whole lot of connections.
It would be disingenuous to say that politics and who's who is not a part of it.
Pastor Clarence Williams leads a church on the south side of St. Pete, a minority community hard hit by the virus. It took one of his members with a line to Tallahassee for his church to be chosen for a vaccine clinic.
I do want to give appropriate thanks to Senator Roussan, who assisted me.
Church member Renee Flowers is also a Pinellas County commissioner.
Is it a fair process? Is it based on relationships or data?
It's relationships, it's not data. If it was based on data, the state would reach out and contact organizations within those communities of color, within those high-risk zip codes.
We are talking about everybody who is underserved.
Meantime, this church, also in St. Pete, is ready, willing, and able, but has yet to get the state's blessing for a clinic.
I don't know what they're doing, but I know what's not working.
On the East Coast, Florida Representative Omari Hardy had to call a buddy who happens to also lead the state's Division of Emergency Management.
I asked him personally to open up a vaccine site in our community.
10 days later, this church in the heart of West Palm Beach's African American community got vaccines to host a clinic.
That's not the way it should work. There should be a data-driven process that determines which sites are selected.
The state even admits its church selection process is based not on data it collects, but on the word of people. In a statement, a spokesperson said the state relies on the expertise of members of these communities to propose and identify locations for these vaccination clinics. The problem?
So how is the state choosing churches to work with?
I don't have a clue.
The state is only listening to some of them.
You don't even know?
No, ma'am. I really don't know.
Leon County Pastor Dr. R.B. Holmes chairs a statewide voluntary task force he and other minority leaders created to help ensure minority communities get equal access to the vaccine. But months after inviting the governor to partner up, Holmes hasn't heard a thing.
If the governor of Florida not want to work with us, want to work around us and cherry pick, God bless him. He the governor.
To date, the state has partnered up with more than 50 churches across 18 counties. Nearly 35,000 people have gotten their first dose at one of these clinics. But statewide, minorities still account for just 6% of all vaccinations administered.
Without a doubt, it boils down to relationship.
Churches in Miami-Dade and Broward counties have hosted the most state-run church clinics. With the highest populations of minorities and positive cases, it only makes sense. But so too does the politics.
If you ask, is it fair? No, I don't think that is fair. I think what's fair is to have a plan and execute that plan.
A state spokesperson tells us they are working with locals to identify churches each week. Meantime, Pastor Holmes and his task force have identified 100 churches and communities of need with the space to accommodate these clinics. They just haven't received the state's blessing to move forward. Katie LaGrone, WSFL TV.